When I started as a nurse at Avera, the mode of communication was telephone and a written message on a paper from the unit secretary to say, call someone, or here's your lab results, or whatever the communication element might be.
The old way of communication was fragmented, unreliable, and often time-consuming.
Well, the vision for the Volt project across Avera was to bring the care team together with a device that would do both voice and text. The goal and the plan for direct communication with Avera is that we will have a common directory.
Communications improve between nursing and physicians via Volt by that, knowing who's available, who's the contact person. Texting is huge to where you can send a brief snippet of information and the physician can then decide, is this something I need to respond to now, or can it wait 30 minutes when I'm done dealing with another patient? The role Volt's played in standardizing communication across our disciplines is having one device, one tool, one method of contacting each other. I would say the directory has been huge for us at Avera McKinnon, being able to know who's your go-to person, for example, for pharmacy that day, not just looking up a pager number and guessing who's going to be on the other end.
As an example, a nurse in Avera Sacred Heart or Queen of Peace can simply look up Avera McKinnon and see what nurse to give direct information, direct report to with just a single lookup.
It's really nice to have a single device with a directory that I can look up, understand, and find out very, very quickly who I need to talk to get something done for my patient. Kind of adds a little bit of small town feel to our pretty big hospital. Discharge process is smoothed out a little bit. In the past, it was very unclear when the discharge order was written. And so now that we're able to communicate directly when that discharge order is placed, I think our nurses have a much better idea. Hey, the doctor's ready to go. Now my job has started. And so it's a much more clear passing of the baton to the rest of the team to get the patient ready to go home.
Probably the biggest impact we've seen is just our patient throughput throughout the organization. We've had extremely high census, so we've had wait times in our recovery room, in our emergency department. We have facilities from outlying areas that maybe have to hold on transfers until we have an open bed, so it's just allowed us to get patients through and into a room quicker.
Extra time for caregivers means that we can spend time doing what's important for patients, and that's making them feel better or thinking about the complexity of care we have to give them.
Volt has improved overall patient experience at the hospital, and we know that because of our patient satisfaction scores. That, to me, was proof in the pudding, if you will, that the Volt platform really was a home run for our nursing staff.
Implementing Volt at Avera has helped communication because it's made it very easy for me to do the right thing at the right time.